Hello everybody, I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia, and you are on a Dr. Y channel. So we continue to talk about your big exams, questions of your big exams that you can find in your tickets. And all questions tomorrow is about peptic ulcer disease. Actually, if you find in your questions in your ticket, examination ticket, so gastric ulcer or duodenal ulcer, it's all about this. So once again, take papers, notes, to making the notes, and let's go. So what is a peptic ulcer? Peptic ulcer is an erosion in a segment of a gastrointestinal mucosa, typically in the stomach, gastric ulcer, or the first few centimeters of the duodenum ulcer, that penetrates through the muscularis mucosa or muscularis mucosae. Nearly all ulcers are caused by Helicobacter pylori infection or non-steroidal anti-inflammatory drugs. Symptoms typically used: burning, epigastric pain that is often relieved by food. Diagnosis is by endoscopy and testing for Helicobacter pylori or pylori. Treatment involves acid suppression, eradication of Helicobacter pylori if present, and avoidance of NSAIDs. So, my friends, if you answer like this, no, quite enough. So once again, the same as I talked in the previous lecture concerning gastritis, it's not my opinion. So you have to answer like this. So for me, all history is about Helicobacter pylori, it's fairy tale. But it's not my opinion. You will answer on the questions, not me. Okay? So my opinion, it's for you maybe, but for exams, you answer in this manner mentioned above. So ulcers may range in size from several millimeters to several centimeters. Ulcers are delineated from erosions by the depth of penetration. Erosions are more superficial and do not involve the muscularis mucosa or muscularis mucosa. Ulcers can occur at any age, including infancy and childhood, but of course, most common, we see that in the middle-aged adults. So the principal key points are that peptic ulcers affect the stomach or duodenum and can occur at any age, but most common middle-aged adults. Most ulcers are caused by Helicobacter pylori or NSAIDs, so non-steroidal anti-inflammatory drug. Both factors disrupt normal mucose defense and repair, making the mucosa more susceptible to acid. Burning pain is common. Food may worsen gastric ulcer symptoms but relieve duodenal ulcer symptoms. Acute complications include gastrointestinal bleeding and perforation. Chronic complications include gastric outlet obstruction, recurrence, and when Helicobacter pylori infection is the cause, stomach cancer. Oh my God. So diagnose with endoscopy and do tests for Helicobacter pylori infection. Give acid suppressant medications to eradicate Helicobacter pylori. Okay, if you add this, it's built for it's for excellent mark. But I see actually continuation of the question, so we have to answer all the questions. And one of these is the etiology of peptic ulcer disease. So the etiology of peptic ulcer disease is multifactorial, involving a complex interplay of various facts. Once again, so my friends, I will not repeat that. You understand? It's not my opinion. It's described like this, so it's described like this. Described like this. So Helicobacter pylori infection. Helicobacter pylori is a type of bacteria that can colonize and infect the lining of the stomach and duodenum, leading to chronic inflammation and damage to the gastric mucosa. It's considered one of the main causes of ulcer as it weakens the protective mucous layer of the stomach and duodenum, making it more susceptible to damage. from stomach acid. NSAIDs, non-steroid anti-inflammatory drugs, such as aspirin, ibuprofen, and naproxen, are commonly used for pain relief, but they can also irritate the gastric mucosa and disrupt the normal protective mechanisms of the stomach lining. Prolonged use of NSAIDs, especially at high doses, is a significant risk factor for ulcer development. Actually, for example, if you take me, just one ibuprofen or indomethacin, kill me. It kills me immediately. So not only prolonged use of NSAIDs. Gastric acid hypersecretion, excessive secretion of gastric acid can overwhelm the protective mechanisms of the gastric mucosa, leading to increased susceptibility to ulcer formation. Conditions such as Zollinger-Ellison syndrome, a rare gastric secreting tumor, can cause increased acid production and associated with higher risk of ulcer. Genetic factors. There is an evidence to suggest that genetic factors may play a role in the development of ulcer. Individuals with a family history of peptic ulcers may have an increased risk of developing ulcers themselves, although the exact genetic mechanisms involved are not yet fully understood. Actually, nothing fully understood, not only ulcer. Lifestyle factors. Yes, lifestyle factors. Certain lifestyle factors such as smoking, excessive alcohol consumption, so like the same like in gastritis, and stress have been associated with an increased risk of ulcer. These factors can contribute to increased gastric acid secretion and weaken the gastric mucosa defenses, making the stomach lining more susceptible to damage. Other factors may contribute to development of ulcer include advanced age, presence of other medical conditions such as liver cirrhosis of chronic kidney disease, and prior history of peptic ulcers or gastrointestinal bleeding. So it's important to know that peptic ulcer is a disease, is a common complex condition. Then the exact cause can vary from person to person. Often multiple factors may act together to increase the risk of developing ulcers. Proper diagnosis and management, risk factors such as treatment of Helicobacter pylori infection, avoiding, of course, prolonged use of NSAIDs, and adopting of healthy lifestyle are important in preventing and managing peptic ulcer disease. Symptoms and signs, I suppose. Yes, next question is a clinic. Clinic, you understand, my friends, this is symptoms and signs. So symptoms of peptic ulcers depend on ulcer location and patient age. Many patients, particularly older patients, have few or no symptoms at all. But anyway, pain is most common, often localized into the epigastrium and relieved by food or antacids. The pain is described as burning or gnawing, or sometimes as a sensation of hunger. The course is usually chronic and recurrent. Only about half of patients with characteristic pattern only about half of patients present with the characteristic pattern of symptoms. So, yes, I know, I'm absolutely sure that the professor will be, if there's a specialist in gastroenterology, will be present. And the jury will ask you about what the differential diagnosis concerning complaints in gastric and duodenal ulcers. So, gastric ulcer symptoms often do not follow a consistent pattern. For example, eating sometimes exacerbates rather than relieves pain. This is especially true for pyloric channel ulcers, which are often associated with symptoms of obstruction. for example, bloating, nausea, vomiting caused by edema and scarring. Duodenal ulcers tend to cause more consistent pain. Pain is absent when the patient awakens but appears mid-morning and is relieved by food but recurs 2-3 hours after a meal. Pain that awakens a patient at night is common and is highly suggestive for duodenal ulcer. In neonates, perforation and hemorrhage may be the first manifestation of duodenal ulcer. Hemorrhage may also be the first recognized sign in later infancy and early childhood, although repeated vomiting or evidence of abnormal pain may be a clue. So peptic ulcer is a condition characterized by the presence of open sores, known as ulcers, in the lining of the stomach or the first part of the small intestine, called duodenum. So the symptoms and signs of peptic ulcer disease can vary depending on the location and severity of the ulcers, but commonly include abdominal pain. The most commonly symptoms of peptic ulcer disease is a burning or growing pain in the middle of upper abdomen. The pain may be dull, achy, or sharp, achy or sharp, and can range from mild to severe. It may be intermittent or persistent and can worsen or improve with eating or taking antacids. Nausea and vomiting. Ulcers can cause nausea and vomiting, particularly if the ulcer is located in the stomach. Loss of appetite. Some people with peptic ulcer may experience a loss of appetite or a feeling of fullness after eating a small amount of food, resembling gastritis. Yeah, I know. Indigestion and bloating. Dyspepsia, commonly known as indigestion, can be a symptom of peptic ulcer disease. It may cause discomfort, bloating, and feeling of fullness in the upper abdomen. Heartburn and acid reflux. Ulcers in the duodenum can trigger symptoms of heartburn and acid reflux, which may worsen after meals or when lying down. Weight loss. In some cases, peptic ulcer can cause unintentional weight loss due to loss of appetite and discomfort with eating. Hematemesis and melena. In severe cases, peptic ulcers can bleed, resulting in hematemesis, vomiting blood, or melena, dark tarry stools, due to presence of blood in the digestive tract. Fatigue and weakness. Chronic blood loss from bleeding ulcers can lead to anemia, resulting in fatigue, weakness, and pallor. So complication, peptic ulcer can occasionally cause complications such as perforation. No, perforation is a hole in the wall of the stomach or intestine, obstruction, blockage of blood or liquid passage or penetration, ulcer extending into nearby organs or tissues, which can cause severe abdominal pain, fever, and require immediate medical attention. It's important to note that not everyone with peptic ulcer disease will experience all these symptoms, and some individuals may have ulcers without any noticeable symptoms. Concerning diagnosis. So endoscopy and sometimes serum gastrin levels. Diagnostic of peptic ulcer is suggested by a patient history and confirmed by endoscopy. Empiric therapy is often begun without definitive diagnosis. However, endoscopy allows for biopsy or cytologic brushing of gastric and esophageal lesions to distinguish between simple ulceration and ulcerating stomach cancer. Stomach cancer may manifest with similar manifestation and must be excluded, especially in patients who are aged more than 45 plus. have lost weight or report severe or refractory symptoms. The incidence of malignant duodenal ulcer is extremely low, so biopsies or duodenal lesions are generally not warranted. Endoscopy can also be used to definitely diagnose Helicobacter pylori infection, which should be sought when an ulcer is detected. Gastrin or gastrine is depending pronunciation, so gastrin secreting cancer and gastrinoma should be considered when there are multiple ulcers, when ulcers develop in atypical locations. Atypical locations, for example, post-bulbar, or are refractory to treatment, or when the patient has prominent diarrhea or weight loss. Serum gastrin levels should be measured in these patients. Complications, but that, okay, once again, okay, complications. Ulcer can lead to various complications, some of which can be serious and life-threatening if left untreated. Bleeding ulcers. Peptic ulcers can bleed, leading to gastrointestinal bleeding. Bleeding ulcers can cause symptoms such as dark or bloody stools, vomiting blood, hematemesis, or signs of anemia, such as fatigue, pallor, and weakness. Weakness. Severe bleeding ulcers may require urgent medical intervention, such as endoscopic, hemostasis, or surgery, to stop bleeding and stabilize the patient. Perforation. If a peptic ulcer erodes through the entire thickness of the stomach or of duodenal wall, it can cause a perforation, which is a hole or tear in the tissue. This can result in severe abdominal pain, fever, rapid heartbeat, and signs of peritonitis, inflammation of the abdominal lining. Perforated ulcers are medical emergencies that require immediate surgical intervention. Obstruction. Peptic ulcers located near the pyloric region of the stomach or the duodenal bulb can cause scarring and narrowing of the gastrointestinal tract, leading to obstruction. Obstructive symptoms may include nausea, vomiting, bloating, and abdominal distension. Endoscopic dilation or surgical intervention may be needed to relieve the obstruction. Penetration. Peptic ulcers can also penetrate into adjacent organs such as the pancreas or liver, leading to inflammation and infection in these organs. Peptic ulcers can also penetrate into adjacent organs such as the pancreas or liver, leading to inflammation and infection in these organs. Penetration can cause symptoms such as severe abdominal pain, fever, and localized tenderness over the affected organ. Penetrated ulcers may require surgical intervention to repair the damaged organ. Increased risk of gastric cancer. A long-standing untreated ulcer, especially if associated with chronic infection with Helicobacter pylori, can increase the risk of developing gastric cancer. Regular surveillance and appropriate management of ulcer and Helicobacter pylori infection can help mitigate the risk. It's important to recognize the potential complications of ulcer and promptly seek medical attention if any of these complications are suspected. Of course, early diagnosis and management of ulcer may help prevent complications, can help prevent complications and improve patient outcomes. Management or treatment. Treatment of ulcer typically involves a combination of lifestyle changes, medication, and, in some cases, eradication of Helicobacter pylori. The treatment plan may vary depending on the severity of the ulcer, the presence of complications, and individual patient factors. Lifestyle changes. Lifestyle modifications may be recommended to manage ulcer. This can include avoiding triggers that worsen symptoms, such as spicy or acid foods, caffeine, alcohol, and stop smoking. Stop smoking, oh, no question about that. Stress management techniques, regular exercise, and adequate sleep may also be beneficial in managing ulcer. Yeah, huh? Medication, a prompt pump inhibitors, proton pump inhibitors, no PPI. PPIs are the most commonly prescribed medication for ulcer and as for gastritis. They work to reducing the production of stomach acid, which helps to promote ulcer healing. Examples of PPIs: omeprazole, esomeprazole, lansoprazole, pantoprazole. Also, we've got H2 blockers, are another type of medications that can reduce stomach and acid production and promote ulcer healings. For example, H2 blockers. Ranitidine, famotidine, cimetidine, etc., etc., etc. Antacids. Antacids can help neutralize. They can help uh, neutralize what? Stomach. Stomach acid and provide relief from symptoms. But they are not typically used as the primary treatment for ulcer. No, previously, yes, not you. We used to give them, but why not? Cytoprotective agents such as medications such as sucralfate and misoprostol can help protect the lining of the stomach and promote ulcer healing. Antibiotics, no, if Helicobacter pylori infection is confirmed, and combination of antibiotics such as amoxicillin, clarithromycin, and metronidazole may be prescribed to eradicate the bacteria. So, eradication of Helicobacter pylori infection. If pylori infection is confirmed, combination of above mentioned antibiotics along with PPI or H2 blockers may be prescribed for a specific duration, usually several weeks, 1 to 2 weeks, to eradicate the bacteria and promote ulcer healing. Treatment of complications. If complications such as bleeding ulcers, perforation, obstruction, or penetration occur, immediate medical or surgical intervention may be necessary to manage the complications severity. And checkup, follow-up and monitoring, regularly follow-up with a healthcare provider may be recommended to monitor the progress of ulcer healing, assess for any recurrent symptoms, and adjust the treatment plan as needed, my friends. I hope you didn't sleep. So that's all concerning peptic ulcers, my friend. Thank you for your attention. Re-listening this video several times for better understanding. Don't forget to follow and subscribe this channel, Dr. Y. See you in another next lectures. Bye bye.